Hey everyone, welcome back to the channel. Today, we're diving into a topic that affects pretty much everyone in the United States: healthcare. Specifically, why does it cost so much? You go to the doctor for something simple, and a few weeks later, a bill arrives that makes your jaw drop. It feels like a uniquely American problem, and in many ways, it is. So, let us break it down together and try to understand what's really going on behind those staggering numbers. First off, it's not just you. The US spends more in healthcare per person than any other developed country. We're talking trillions of dollars every year. But are we getting the best results for all that cash? Well, the data shows our life expectancy and other health outcomes are always at the top of the charts, compared to other wealthy nations. So, what gives? Why are we paying premium prices for what sometimes feels like a standard service? One of the biggest culprits is the sheer complexity of our system. Think about it. We don't have one single system. It's a tangled web of private insurance companies, government programs like Medicare and Medicaid, and direct payments from patients. Each of these has its own rules, its own paperwork, and its own bureaucracy. This complexity creates huge administrative costs. A significant chunk of every dollar you spend on healthcare doesn't go to doctors or nurses or medicine. It goes to paying for the army of people who process claims, manage billing, and navigate this labyrinth. Estimates suggest that administrative costs eat up as much as a quarter of all healthcare spending in the US. That's hundreds of billions of dollars a year just on paperwork and administration. Next, let's talk about prices. In the US, the price of a medical service isn't really standardized. If you need an MRI, the cost can vary by thousands of dollars depending on which hospital you go to, even within the same city. Why? Because there's very little price transparency. You usually don't know the cost of a procedure until after you've had it. Hospitals and insurance companies negotiate these prices in secret. This lack of transparency means hospitals can often charge very high list prices, which are then negotiated down by insurers. But if you're uninsured or your plan has a high deductible, you might get stuck with a bill closer to that inflated list price. This is very different from other countries where governments often regulate or negotiate prices to keep them reasonable. Here, it's more like the Wild West, and that brings us to the role of insurance companies. They act as the middlemen between you and your doctor. Their goal, like any business, is to make a profit. They do this by collecting more in premiums than they pay out in claims. This creates a weird dynamic. They negotiate with hospitals to lower costs, which sounds good, but they also have an incentive to deny claims or limit coverage to save money. This constant back and forth between insurers and providers adds another layer of complexity and cost. Plus, the system is fragmented. Instead of one large entity negotiating prices for the entire population, we have hundreds of different insurance plans, each with different negotiating power, leading to inconsistent and often high prices across the board. Then there's the big one: prescription drug costs. Americans pay the highest prices in the world for pharmaceuticals. There are a few reasons for this. In the US, the government is legally prohibited from negotiating drug prices for Medicare, its largest insurance program. This is a huge deal. It means drug companies can essentially set their own prices for the largest buyer in the country. In contrast, governments in other countries negotiate bulk discounts, driving prices way down. We also have a very long and protective patent system for drugs, which gives pharmaceutical companies a monopoly for years, allowing them to charge high prices without any competition from cheaper generic versions. While this is meant to encourage innovation and the development of new, life-saving drugs, the balance seems to have tipped, leaving patients with unaffordable bills. Another factor is our fee-for-service model. This is the traditional way we pay for healthcare. Every time you see a doctor, get a test, or have a procedure, the provider bills for that specific service. What's the problem with that? It incentivizes quantity over quality. Doctors and hospitals make more money by ordering more tests and performing more procedures, whether they're truly necessary or not. This can lead to overtreatment and unnecessary spending. Many experts argue we should shift to a value-based care model, where providers are rewarded for keeping patients healthy and achieving good outcomes, not just for the volume of services they provide. Some health systems are starting to move in this direction, but the transition is slow and complicated. Let's not forget the high salaries of medical professionals. Now, this is a tricky subject. Doctors, surgeons, and specialists in the US are among the highest paid in the world. They go through years of grueling education and training and rack up huge student loan debt. They absolutely deserve to be well compensated for their life-saving work. However, these high salaries do contribute to the overall cost of care. Compared to other developed nations, the pay gap is significant. This isn't about blaming doctors. It's about understanding every piece of the puzzle. The high cost of medical school and malpractice insurance also gets passed down to the patient. And what about our culture? We have a tendency to want the newest, most advanced treatment available, even if a simpler, cheaper option might be just as effective. This demand fuels an arms race among hospitals, who invest in the latest expensive technology to attract patients and top doctors. An MRI machine costs millions of dollars to buy and maintain. When every hospital in town has one, those costs are distributed among all the patients, driving up prices for everyone. There's a cultural expectation for immediate high-tech care, and that comes with a hefty price tag. Finally, we have to talk about the millions of people who are uninsured or underinsured. When someone without adequate insurance has a medical emergency, they often can't pay the bill. Hospitals are legally required to provide emergency care, regardless of a patient's ability to pay. So, what happens to that unpaid bill? The hospital doesn't just absorb the loss. It shifts the cost to other patients in the form of higher prices. So, in a way, we're all chipping in to cover the cost of uncompensated care. This creates a vicious cycle where higher prices make insurance less affordable, leading to more uninsured people, which in turn drives prices even higher. So, to recap, it's a perfect storm. A complex, fragmented system with massive administrative costs, a lack of price transparency and regulation, a fee-for-service model that encourages more treatment, not necessarily better health, the highest drug prices in the world, and the domino effect of the uninsured population. It's not one single thing, but a combination of all these factors that makes a visit to the doctor so unbelievably expensive in the U.S. Solving this isn't easy. There are so many vested interests, insurance companies, pharmaceutical giants, hospital groups that resist change, but understanding the problem is the first step. When we know why the system is broken, we can have more informed conversations about how to fix it. Whether it's through more price transparency, allowing Medicare to negotiate drug prices, or moving towards value-based care, there are paths forward. It's a huge challenge, but it's one we have to face. What are your thoughts on this? Have you had a crazy healthcare billing experience you want to share? Let me know in the comments below. I read every single one. Thanks so much for watching, and if you found this video helpful, be sure to hit that like button and subscribe for more deep dives into the topics that matter. See you in the next one.